Hi, I'm Dr. Will McAllister of the Port Adelaide Chiropractic Clinic in South Australia. We're putting together a short video to describe what chiropractors actually do and what is chiropractic. But first of all, the name chiropractor is derived from two Greek words. The first chir refers to the hand, and the second praxis refers to practice or treatment. And as you can readily see, the English word chiropractor means to treat or to practice with the hands. The term was first coined by D.D. Palmer, the discoverer of chiropractic, way back in 1895. At that time, Palmer discovered that adjusting spinal segments, that is the vertebra, had beneficial effects on his patients. And one of the basic beliefs of chiropractic is that the body itself has the inbuilt ability to restore health, and that chiropractors merely assist nature to that end. This inherent ability is sometimes described as the innate intelligence, and refers to the inner mechanism in everyone that controls digestion, heals our wounds, develops growth in the bones and in our bodies from gestation through to adulthood. However, holistic chiropractors believe that the health of the body does not just depend upon the spine. In this illustration, the chemistry side includes digestion, nutrition, pure air and water, all essential elements for good health. And the intellect side of this illustration includes neurological functions, such as the function of the brain, its mechanisms and its thinking, the spinal cord and peripheral nerves. And the structural side includes muscles, skeleton, the heart, because the heart is a pump, legs, arms, eyes, mouth, tongue, etc. In short, the body is one whole unit, one whole mechanism, and all parts, chemistry, intellect, structure, are all important for health. Generally, however, chiropractors deal with musculoskeletal problems of the spine, pelvis and other movable skeletal joints such as the jaw, the knees, feet and hands. Some symptoms, however, hint at other underlying problems which the chiropractor will refer to the appropriate medical practitioners or other. Most chiropractors treat people who are suffering with vertebrae that are described as being out. This really is a layman's term and refers to vertebrae that are technically still in joint but not properly in alignment with the vertebra above or below, as in the illustration. And in this illustration, the vertebra is being rotated to the right. When vertebrae are rotated, called misaligned or twisted, or some even crushed, they can cause compression of the nerves that exit from in between the vertebra. In the top illustration on the right, we are depicting nerve compression in the lower neck and upper thoracic vertebra. This can cause nerve pain down the arm, often accompanied with tingling or numbness in the hands or fingers. There are other reasons for these symptoms, and a competent practitioner, competent chiropractor, can determine the origins of these symptoms and, if necessary, refer them to other practitioners. Lower back pain is probably the most common reason people visit chiropractic clinics, and there are a number of causes for these pains. They may be due to spinal degeneration, or the degeneration of the disc that is between the vertebrae. Pain may also come from muscular strain due to awkward or heavy lifting, or pain may be the result of a combination of many of the above. And one of the things that chiropractors know, and we all need to remember, is that the human spine is reinforced throughout its entirety by strong ligaments, much like the fibre reinforced garden hose we see illustrated on the right. These ligaments, in this illustration, we see some of these ligaments joining the vertebra to the pelvis. When these vertebrae rotate, they or misalign or twist, The pelvis likewise would have to be affected because the ligaments are pulling on them. And this is what we see in this illustration. The fourth and fifth lumbar vertebra are being rotated to the right, and we observe that the right hip, that is the right ilium, is also being rotated, being pulled by these ligaments, and mostly upward and forward, causing the appearance of a short leg on the right side. In conclusion, this short video is only a short look at some of the aspects of what chiropractors do. We all realise that pain comes from a multitude of causes outside of the musculoskeletal sphere, and chiropractors are aware of this too. So whenever it is suspected that the origin of a patient's symptoms is outside of the chiropractic's jurisdiction, say heart problems, gallbladder attacks, or worse, cancer and others, if this is suspected, the chiropractor will always refer the patient to the relevant practitioner.